Hello everyone. Happy Tuesday. So excited to have you guys joining us today. We're gonna get started in a minute. Hope everyone has had a good Tuesday. Was it a good, I don't know. Tuesdays don't really feel relaxing, but hope everyone had a decent Tuesday. So today we're actually going to be, thanks for leaving the hearts. I'm dropping things everywhere. 1 second. Okay. All right, we can get started soon. We don't have a guest, it's just me here today. So today we're going to be talking about demystifying PrEP. I wanted us to just start off the new year having a good knowledge of what PrEP is and being able to just like talk to each other about what it is. So, hey Ramon, thanks for joining. So we can get started very soon. Just give me 1 minute. Let's see. All right, so we can go ahead and get started. So my name is Ibuku. I'm the social media outreach here at Whitman-Walker, and I use she, her pronouns. And today I actually wanted us to talk about PrEP and just kind of what it is. So as I say this all the time, our community health department has really expanded its outreach efforts to the social media platform. So you've seen us talk about literally a lot of things, and PrEP is something we try to talk about often. So today I just want to give us good background knowledge of what PrEP is. So today I will be demystifying common myths about PrEP. I will be on for about 20 to 30 minutes, so please comment any questions or concerns you may have as they come up. So first things first, what is PrEP? So PrEP actually stands for pre-exposure prophylaxis. So PrEP is an HIV prevention method that greatly reduces anyone's chances of becoming HIV positive if they're exposed to HIV. So there's currently kind of two options for taking PrEP. So there's the oral method, which is like taking pills, and the two FDA approved PrEP medications currently are Truvada and Descovy. And then recently, which has been really cool, there's actually been a recently FDA approved injectable PrEP, and it's called Apretude, and it's basically a shot that for your first dose you take it. Your first two shots are taken within the first 2 weeks, and then going forward you just take them every 2 months. And I think that's pretty cool because currently we only had Descovy and Truvada to give to patients, and you had to take it every single day. And for some people that just does not fit their lifestyle, they will forget to take it. And I'm going to talk about that later, but if you are not taking your medication as you should, it doesn't work as well as it should. So I just wanted to talk a little bit about the difference between PrEP and PEP. So like I mentioned before, PrEP stands for pre-exposure prophylaxis, while PEP stands for post-exposure prophylaxis. So they're both medications that you take to prevent your chances of getting HIV when you have a possible exposure. But really the difference is PrEP, you take it before an exposure because it's the pre-exposure, and then PEP, you take it post-exposure after you've been exposed. So with PrEP, when you take it every day, it has a 92% effectiveness rate at stopping you from getting HIV. And similar with PEP, they have the same effectiveness rate. It's just like the time frame you take it is different. So with PEP, you take it post-exposure, so after you've been exposed to HIV, and you take it for 28 days. It's an oral pill as well, and that ultimately prevents you from getting HIV as well. So does everyone kind of understand like the difference between PrEP and PEP? They're both methods that you take. They're both medication that you take to prevent you from getting HIV. The difference is one is just like pre and the other one is post. So the way I like to really explain it to people is by saying PrEP is your birth control of HIV prevention, while PEP is the morning after pill. So with birth control, you have to take it every single day for it to be effective, and it reduces your chances of pregnancy, same thing with PrEP. You take it every single day and it reduces your chances of getting HIV. With PEP, you take it after you've actually been exposed. So if you feel like you had an encounter that was kind of risky, or you just didn't know the person well, or the person disclosed to you that they were HIV positive and you didn't use protection, you can take PEP within 72 hours and it will prevent you from getting HIV. So I think that's pretty cool. So I have some myths that I've kind of like put together that I've kind of heard from different people. So I just want to talk about it a little bit. So one myth is PrEP doesn't treat HIV. So the medications used for PrEP are part of the complete HIV treatment regimen, but it does not treat HIV alone. So when you take PrEP, you're not treating HIV. You're really preventing yourself from getting HIV. So it's really for people who are currently HIV negative, and it reduces them from turning from a HIV negative individual to becoming HIV positive. So PrEP can actually have up to a 99% effectiveness rate of you getting HIV if you take it every single day for a consistent amount of time. So you can't just like take PrEP and then stop and then have unprotected sex and think you're not going to get HIV. It doesn't work like that. You have to take it consistently. So then another myth I hear is like PrEP, the efficacy / risk reduction percentages are a little bit like wonky for people. So like I mentioned, it has an at least 92% effectiveness rate, and that increases depending on how do I say this? Like depending on how consistent you are with taking the medication. So if you're not taking your medication every day or as directed, it's not going to be as effective. So for sexual transmission through rectal tissue in men who have sex with men, studies have shown that if someone takes PrEP 7 days a week, the estimated level of protection is 99%. So more studies are actually needed to determine the exact protection for vaginal and cervical tissue transmission, but we can predict that it's going to have a similar effectiveness rate for those other types of sex. Another thing I hear from patients is that they're worried about the side effects. You know, they're like, I don't want to have these adverse side effects. Like, that's why I'm not going to take PrEP. So actually, most people don't report having side effects. So we really try to tell people, yes, there's a chance you get side effects, but that should not be a deterring factor for you. Like, you should still look to see if you are an eligible candidate, or if this is a great medication that's right for you. So only about 10% of people that take PrEP actually end up having these adverse side effects, which are often really mild, and they usually last maybe like the first week or the first 2 weeks of you taking the medication daily. So some of these side effects can be nausea, vomiting, diarrhea, headaches. And like I said, these often actually end up going away pretty quickly. And also a small percentage of people who take PrEP end up having adverse kidney function and bone density. But these side effects, once again, like I said, are not common. And there's a lot of checkpoints. I like to tell people there's a lot of checkpoints to prevent you from actually having having these long-term side effects. So for example, when you get on PrEP, you have 3-month checkups with your physician just to make sure that they're called a metabolic panel, and basically at these checkups we're making sure that your kidney and liver function are still up to par and are not being affected adversely. So if any changes were to occur, your physician would know, and they would know that maybe you need to stop taking PrEP for a time frame so that your body can recover. So now I wanted to talk a little bit about how to get started and some frequently asked questions about those. So for PrEP, it starts with a conversation. So typically this can be a conversation with a primary care doctor, a medical team member, your HIV testing counselor. Like, I could talk to you about PrEP, and really we're having this conversation to determine if this is the right medication for you. So once the person has decided, okay, this is what I want to do, and they've had the conversation with the right person, we now decide how are we going to make this appointment, right? So PrEP reaches its maximum protection for receptive anal sex after 7 days of daily use, and for vaginal sex and injection drug use after 21 days from when the person starts using PrEP. So usually, we let the people know who are interested in PrEP, we'll let them know like how many days they need, to take PrEP before they can expect those protective factors to start coming in. So another question we have often, people always want to know, how much does it cost? Like, how am I going to afford this? Because it is an expensive medication, but I do want to say that the cost of PrEP varies depending on your insurance status and what the insurance plan covers. So if a person is insured, most insurance plans, both public and private, cover PrEP, but the monthly out-of-pocket cost / copay can change from person to person. So we also know that navigating insurance and PrEP can be difficult. So we do have a insurance helpline, which is 202-745-6151, which is a great resource we share with people so that they can figure out just how much it's going to cost them. So we also have a PrEP navigator, and this person really helps individuals really kind of just navigate the whole financial aspect of getting on PrEP, so that so that finances aren't a barrier to starting this medication that can be life-changing. And finally, there's also assistance programs through Gilead, which is actually it's not a person, it's a company that makes Truvada and Descovy, which are the medications I mentioned earlier, which are the medications for PrEP. So they actually have assistance programs that help individuals who need help paying for PrEP. So these can be people who don't have insurance, or also people who just can't afford the copay if they do have insurance. So there's definitely different ways to get around affording PrEP, and we try to make sure people know about those different ways. So another question I have is, do I have to take the pill for the rest of my life? No, you absolutely do not have to take it for the rest of your life. You really want to take PrEP when you're the most sexually active, and your risk of being exposed to HIV is the highest. So for example, some people stop taking PrEP once they are in a long-term monogamous relationship with a person who is HIV negative, or they have a partner who's living with HIV and has already achieved and has maintained an undetectable viral load. So this is to say that they've been taking their antiretroviral treatment for HIV as directed, and they have so little HIV in their body that they cannot actually transmit it to anyone else. So like another thing I just want to talk about is like U equals U, which is undetectable equals untransmittable. So basically, when a person is undetectable, an HIV positive person is undetectable, they can't actually end up transmitting HIV to anyone because their viral load is so suppressed to that point. So if you are in a relationship with a person who is HIV positive and they are undetectable, you technically don't have to take PrEP anymore because your risk of getting HIV is non-existent, as long as your partner stays undetectable. And that's up to them to do that by taking their medication and treatment as they should. So a question I have is, what if I don't take the pill every day like I'm supposed to? There's some days you just forget, or, you had a bad day and you just didn't remember to take it. So depending on the number of days that the person is not taking the pill, the level of protection decreases. So basically, in general, the more days you miss, the lower your level of protection becomes. So we really urge people to try not to forget it. But if you do happen to forget one day, just get back on the next day, and your protection level shouldn't have been affected too much. It really becomes a problem when you're like 5 days off and then you try to get back on, and then you're 7 days off and try to get back on. That's not really helping you. Your protection level is not really there. So another question is, do I have to take the pill if my partner is undetectable? So like I said, no. If your partner is undetectable, it means your partner has no risk of actually transmitting HIV through sex. So that's really what undetectable means. So in that case, I would say PrEP is not necessary, but it's not up to your partner to make that decision for you. We try to, empower our clients to make the best decision for themselves. So if you feel like your partner is going to stay undetectable, then you can get off PrEP. But if you are a little bit worried, we still suggest you stay on PrEP. So therefore, PrEP is still an excellent option to prevent HIV through sex, but it depends on the nature of the relationship you're in. So that's basically all I have for you all today. Does anyone have any questions about anything I've talked about with PrEP? I tried to explain all the frequently asked questions or misconceptions people have about PrEP. Do you have any questions? Let's see. Did I miss anything? Can you take PrEP with birth control? Yeah, so you can take PrEP with birth control. They don't negatively react with each other. It's actually really common for women to take PrEP and birth control at the same time, because PrEP doesn't prevent you from not, getting pregnant, and birth control doesn't prevent you from not getting HIV. So actually both of them together, that's a great combination if your goal is to prevent HIV transmission as well as unwanted pregnancy. Thanks for the question. Do you have any other questions? Okay. So if we don't have any questions, that's okay. You can just leave them in the comment section once I post this. As usual, I do have to leave us with a little tidbit about COVID and vaccinations and what we have to offer. So if you've not been vaccinated, you can still get a vaccine from us at Whitman-Walker. Just call us at 202-207-2480 to schedule an appointment. And if you need help finding vaccines and you're not able to come to our center, please check out vaccines.gov. It's a great resource to scheduling appointments around you. Like I always say, please follow us on Instagram, TikTok, Twitter, Facebook. Check out our website. There's a lot of important information there. And if you ever have any questions, you can just give us a call and we're always willing to help. But thank you so much for joining us today, and I will see you sometime this week. Have a good day. Bye.